My name's Maverick. I'm in here because I got burnt first and second degree burns. And first degree is where you just have just red and swelling. Second is where like blisters up. Now, that'd be a first degree, wouldn't it? Right there.
No, it's
No, it
usually
wouldn't
when it
even
burns
be a
through down
first
to the muscle.
I can't really show you it, but I got burns on my arms and face. There's my food.
Nutrition here, should I go? We're laughing because we're trying to do a video here, and it's like everything goes off. And
Oh, okay. Distracting you, huh?
if you hang around long enough, we'll make you be in it too.
Oh.
Yeah.
Well, she looks like she wants to be. She's
Yeah.
like, oh, I'll be happy to.
Thank you.
My lamb shot going here.
Is it off now?
No, it's been run over. We cut it up anyway we want to.
Okay. Maverick, tell me you've been here 12 days and you've had 3 debridements.
I've been here 12 days and had 3 debridements.
You just tell them, say debridements was where they take off the dead skin and clean off the wound.
Yeah, debridements are when they take off dead skin and clear your wounds.
Okay. The world interrupted the interview, right? Now, so somebody sees you for the first time, they're not going to know if you're the masked Marvel or there's a reason you had those bandages on your face, right?
Yeah.
So tell them about the bandages on your face. Kind of what you have there.
Oh,
You know why they're there.
yeah.
Yeah.
Okay.
Cover up a burn. I don't know why they're there.
So tell them, say I have the bandages on my face for a reason because I had some flash burns, on my face.
I keep bandages on my face because I have burns on my face.
Okay. So say so you've been here what 12 days? What is that?
Oh yeah.
So say how is it different now from when you first came in? So what's changed since when you first came in?
Well, when I first came in, I didn't know what to expect. I wasn't really thinking. But when I sat down because I got bored or something, I just sat down and just thought of what it was gonna be like. And it just flies by.
They tell them they kept you sedated 3 or 4 days so you don't remember much.
Oh yeah. Yeah, they kept me sedated for the first 3 or 4 days. And I guess didn't know what was going on.
So what things have you done while you've been in the hospital to help you kind of get through the days?
Watch TV. I really haven't done a lot of that. I've been watching a movie, but I really don't watch TV a lot. It's not. But I guess once you get into something, then time just goes by, I guess. And then you sleep.
So what things could you tell kids that you worried about at first, but you found you didn't really need to worry about? Because I think that's a big thing of what people worry about, when they've not been through this before.
I worried about going into surgery. I didn't think it was just going to be just a scrub down, but I thought it was going to be worse than that, just cutting you open and stuff. But it wasn't. It wasn't really nothing. It was just going in there and getting cleaned. It wasn't. I thought I was going into a big surgery or something, but and sometimes you worry about. You're gonna be in here for a while and nothing's gonna help you and stuff because you keep on hurting. But they help you.
Yeah, well, that's a big thing to talk about. So talk about pain and one thing would be really nice. So go ahead, Amy, talk a little bit about what kind of what his grandma just talked about as far as
Okay.
the process of dressing.
Yeah. So we changed Maverick's dressing this morning. We're doing it twice a day, and he did a great job. And so what we have to do is we have to soak all of his wounds in acetic acid and saline, and then we have to go through and dab everything off with saline again. And then we have to put collagenase on the white parts of the burn, and then we put bacitracin on the other. And we cover it all in Vaseline gauze, and then we put his stockinette back on, and that's it. And he did a great job.
So how's he been as a patient for you today?
As a patient, he's been perfect.
Mhm.
I have not had a problem with you.
So what's so perfect about it?
Other
What-
people
what-
whipped you into shape, didn't they?
Actually, he's been pretty good
Has
for
he
the most
been?
part. He's been a gentleman. I mean,
Yeah, he's been very nice,
Some-
very appropriate, and
so some kids with burns
Mhm.
aren't so nice, are they?
right.
They don't get, I mean,
Some of them are hateful. Grandma's called you grouchy today, hadn't she? Yeah.
the grumpy old man today.
And you tell them about the last
Oh.
debridement that they put a bandage on. It's like a
Yeah,
snake skin.
so the bandages that he has on now are what Janice Bickett calls like something like, she referred to it as something or an adjective of how a snake would shed out of its old skin. So it's going to help heal everything, and they will take it off in about a week. So everything else stays on.
It kind of sheds itself.
Hmm.
And with the nature of his burn, okay, especially his facial burn, several months from now, how different do you think it'll look?
Well, according to Miss Betty this morning, he looks like a totally different kid because she's
Yes.
apparently taking care of him a lot, and you can tell like the healing parts of the good pink skin on his face whenever we changed everything. So I think with everything he's done that he'll look awesome.
They said probably 1 year for all the coloration and stuff.
With different layers of tissues are going to grow back and everything. Yeah. Yeah. So now it's your turn to talk about the nursing care. So what?
I'll leave you alone while you do that. Just yell at me if you need something.
You really
okay?
feel, right? So any advice to the kids about getting nursing care and how to treat your nurses and
Oh yeah, when you get aggravated, just like go to sleep or something. That's what, like you can do all that stuff in your dreams. Like they're just trying to help you. They ain't trying to when they rub you and it burns and stuff. They ain't trying to hurt you. They're just trying to help you.
So be nice and
you're coming apart.
Yeah, I fell apart.
There goes a part of Maverick.
Yeah.
Yeah. So what's the secret about medicines for pain? What do you think is the most important thing for kids to know about medicines for pain?
What?
About the medicine they give you for pain. What do they give you and how does it help?
Well, the morphine, it doesn't go on for a long time, but it doesn't help you for a long time, but it helps you better because you really don't feel like yourself, you're that you're not, and it takes all pain away, but it only works for an hour or so. But the Norco or Narco or one that starts with the N, the pill, that other one goes through that
the vein.
IV, and is it Norco? Norco goes through, it's a pill that goes, or takes about 30-45 minutes to kick in. Maybe not that long, but it feels like that long. And that one helps you for about 2 hours, 3 hours. And I like the Norco better because I know it's gonna help me longer and I ain't gonna feel my pains.
Now, how's your pain medicine different now than the first few days?
Well, the first few days, once it wore off, I could feel a lot of my pains, through my arms and stuff, but now when it wears off, it's not so bad. Just as long as like I ain't jumping around and stuff like I did when about 2 days when I got here.
About 2 days, okay. When you're moving around a lot. Okay, yeah. You know, I remember sometimes you were chilled and things like that, right?
Yeah.
I think you're really chilled and kind of uncomfortable. Is all that gotten better?
Yeah. I get hot a lot.
So, what's the advice you got to give them about eating and why they need to eat a lot?
Oh, well, they say protein is like helps your skin grow back, and calories help, I guess, skin grow back. So they want you to eat a lot because they don't want you to like not heal, but you also need to eat a lot because, I mean, even though you don't feel hungry, like your body needs that energy.
When you remember we talked about how when your body's healing itself after a burn, you use a lot of calories. I mean, your whole metabolism is, it's almost like you're running a marathon, right? Okay. So tell them that. Say something like, like when your body's healing from a burn, it's like you're kind of running a marathon or a long race. So you need all that protein and calories, to help your body heal. And so for that reason, eating and drinking, what'd you have, Ensure? Something like that can really be helpful. So can you put that in your words?
Yeah.
You need to have cue cards up there, right?
They do need cue cards.
Yeah. Of course, if I had cue cards, you go, your body needs a lot of nutrition. I mean, people.
I'm gonna make this.
Ready? Go. I didn't.
Almost got it.
Close.
Okay, tell them honey, this.
Alright.
Tell them I just.
Well, calories are.
Sure, prop. Say, food is important for what reasons?
Food is important because it's like.
That's his word.
I know.
You're going to be on the tape. We're going to hear you. Yeah. Okay.
Food is gotta be like. Start over. Calories are good because it's like running a marathon. Your body needs calories to heal your burns, and it's like a long race to heal your burns.
Carry your boots on there. Okay, I've taught you almost enough. So, any last words to kids just about how to keep your, try to stay optimistic, how to kind of keep your spirit up. Tips to getting through the day, things like that.
Oh yeah.
It's like a pep talk. You're like a cheerleader here.
Yeah, like don't get down about yourself just because you're gonna have to be in here for 10, 12 days. So just don't be like, oh no friends, not going over to people's houses. It's all gonna get back to you. You just need to calm down and eat, drink, sleep, live. So don't get thinking what's coming. Oh, my bad. Don't think about what's gotta come. Try to think about what's staying or what's happening right now, because you need to
Edit that out.
I'm glad I can't smell. I will not have
It
to.
happens a lot. Okay.
I don't even know.
I said
Stay positive is what he's trying to say.
stay positive. Don't be embarrassed about what some people do. Well, yeah, see, don't get down.
You'll get better, right? You'll heal. Right?
Yeah, take everything as a good thing and not a bad thing.
So at some point when you get your bandages off your face and all that, you're gonna like send me a picture so I can put that in video.
Yeah.
I think we'll show you like how you're doing. Yeah.
Yeah, and don't do what I'm doing right now. So I'm like picking it like I'm.
Don't do what I'm doing.
Yeah, I just.
Yeah, you gotta be careful because you don't want to. You're in a better place now, but everyone if you get infection, you know.
Yeah.
If you pick that up and then
Yeah.
you don't want to create scars with that either.
So I'm like picking all my stuff up.